Welcome everyone to FAQ Live. Thank you for joining us. It's a great pleasure to be with you tonight. I'm Ann Galloway, the editor of VTDigger, a statewide nonprofit news organization that serves Vermont. It's my distinct pleasure to introduce you tonight to Jan Carney, the Associate Dean for Public Health and Health Policy and Senior Advisor to the Dean at UVM's Larner College of Medicine. Jan previously served as Commissioner of the Department of Health from 1990 to 2003. In addition to her faculty and advisory roles, Jan actively leads research efforts related to rural health, social determinants of health, and local and national health policy. Tonight, Jan will answer your questions about vaccines. Who is eligible and when, how efficacious the different types of vaccines are, when boosters might be available, and whether it's safe to fly, go out to eat, or hug your grandkids once you've had the jab. Before we get started, I'd like to thank Mike Doherty, the digital editor for VTDigger, who's producing our live stream tonight. I'd also like to thank our generous sponsor, Garnet Health. Garnet, an integrated healthcare delivery company, offers COVID-19 testing at locations around the state and mobile vaccine administration. Garnet offers PCR and antigen testing with an emphasis on rapid results and efficiency for individuals, businesses, summer camps, and wedding parties. Visit garnet.care to sign up for testing. Thank you, Jan, for taking time out of your busy schedule to be with us tonight.
You're welcome.
It's really good of you to join us. First of all, I was wondering if you could give us an overview of how you think the vaccine rollout is going and what it will take for the state to return to normal.
Okay. Short answer, I think it's doing great. And I think that we're very fortunate to be here, and we have our great cooperation between our Department of Health and our healthcare professionals and University of Vermont. And they're getting more and more vaccine and partnering with pharmacies, and more people are becoming eligible to get their shots almost every day. So I think we're doing extremely well. The last time I checked, we had almost 30% of people had one vaccine. So I think we're really getting there. And, you know, it's hard to say an exact date, but certainly people are talking about the summer and are we going to be close to, can we do more things? And we can't wait. And at least now the weather's getting nice. We can get outside, which is great. But people are really looking forward to that. And so certainly, for example, UVM is fully anticipating more of a normal fall here and class, but in the summer months, there's a great expectation that things are going to be a lot closer to how we like them here in Vermont.
And so what is that tipping point? Is it 60%?
I think initially people said 60%. The real truth is no one really knows. And some of the national experts that I'm all watching are talking anywhere between 70 and 90%. And that's and it depends on a lot of things. It depends on how many people can get vaccinated, how well we can stop people from getting infected in the meantime while we're working on that. And it's sort of this balancing act. And the better we do, the more people will be protected. And I think that will help us in our daily lives.
Well, you mentioned the variants, and I wondered if you could talk about the 3 known variants, and I think there are a couple of other ones, one from New York City and one from California, that have been identified. And I wonder if you could talk about how scientists are conducting surveillance of these variants of the COVID-19 virus and how they're doing contact tracing.
It's the genome was sequenced in like the beginning of January. It's been truly quite remarkable, and with all the vaccine production and that what we have right now. And people are doing what's called genomic surveillance and looking at these different variants. And you expect viruses to mutate. And one of the things I think is really important to remember is they're going to mutate faster. So we have a probability that we have variants that we're worried about in a setting where you're seeing more infections happen fast. So the variants, and they even have a name for it now, it's called variants of concern. There's a lot of variants, but what are the ones we're really worried about? And there's the 3 you mentioned in the United Kingdom, and that's in all 50 states now. And then we have the one from South Africa, And I think that's in about half the states. And then we also have the one from Brazil that's in about 12 states. And all this is on the CDC website, and they have a webpage where you can see that. And there's also a couple more that they've added to the list from California. What's the worry, and what are they looking for? The worry is that these through these variants and how they may act is they are able to get into the cell faster, so that might result in them being transmitted or higher infectivity, and that's been true with some of them. The other way they can work is by masquerading against our immune system, so that it makes it harder for the antibodies that are produced, whether by our infection or the vaccine, to neutralize them. So that's the concern. Big picture, how much of a concern are they? Certainly not as much as the concerns about making the vaccine in the first place, all right? But in terms of keep watching them, doing surveillance for that, really important. And one of the things that's become crystal clear to everyone working in public health is how much we need to have the capacity to do that in a stronger public health system. And in our case, for this genomic surveillance, we also need that globally, and we need that global cooperation. In terms of the vaccines and immunity, the good news is that the 3 vaccines that we have under the FDA's emergency use authorization, or the EUAs, are the Pfizer and the Moderna, now the Johnson & Johnson, all have been very effective against severe disease and deaths from that. Mm-hmm. So in terms of, that's reassuring. The Johnson & Johnson was tested and in a place where they had, many of their people were in a place where they had the South African variant. And so they still had 85% protection from severe disease and 100% protection a month after from people dying. So that's really good. The companies who are manufacturing the vaccines are watching this very carefully, as are all the public health agencies. And so a couple messages here. So what does that mean for the future? No one knows yet, but certainly in the current medical and public health literature, there's some discussion about, will we need to get a booster shot a year down the line to cover any of the new variants that are circulating, right? That's one question. Another perspective would be, these variants have originated where there's a lot of disease activity. So the worry is, if you go back to normal or pre-pandemic too fast, where we have a lot more circulating disease in the United States, that might put selection pressure so that we see more variants here. And we already know that we're seeing some in California. We're seeing ones from the United Kingdom specifically circulating here. So that's one of the reasons that we want to still keep the disease rates down with our continuing to wear masks and being careful in crowded spaces, particularly indoor spaces, and that physical distancing, while we're getting those vaccine rates high as we can, as fast as we can in our population.
We've had a lot of readers ask if they could choose which vaccine they could get. And my understanding is that it's kind of luck of the draw. Do you know if there's any way in which people could, opt to get Johnson & Johnson versus the Moderna or Pfizer vaccines?
Well, I got my first one. I have my second one in about a week or so. I've never been so happy to be getting a shot in my life. And I went in, I had no idea. I was trying to guess. And nope. And I happened to get the Pfizer one. And I said, I'm thrilled. And if they said you're getting the Moderna one, I would say I'm thrilled, or the Johnson & Johnson one. So, whichever one they offer, I really encourage people to take it. They're all highly effective, safe and effective against severe disease and dying from the coronavirus. And unfortunately, we know that we've had more than 500,000 people die in our country so far, and we still have an awful lot of infection around the country. So take whichever one is offered and be delighted.
Well, we're going to hear from some of our readers now who have pressing questions about the vaccine. And the first one is from Christine. She lives in Montpelier.
Christine from Montpelier asks, I'd like to understand the safety of unvaccinated children and youth in a world where many adults have been vaccinated. And what does the timeline look like for vaccines for young Vermonters?
I can't answer exactly when that will happen here. Now, Moderna is doing some trials in children, and currently they haven't been recommended for children as yet. There's a lot of data coming out from all ages of infections and the experience in schools where children have done, by and large, really, really well. So I think that it's really important, and some of the strategies have been to vaccinate as many people as you can, as fast as you can, and first look at the people who, if they get infected, are more likely to get severe disease, be in the hospital, and die. And children, we don't quite know yet. I think that, everyone is working towards return to schools and opening up society in a good way. I'm very comfortable with that, in the direction that we're going, where we're getting more and more adults vaccinated.
Great. The next question is from Penelope, who lives in East Charleston.
My name is Penelope Newcomb. My town is East Charleston, Vermont, and I have two questions. I have heard that a fully vaccinated person is protected but can still infect others with COVID-19. Is this true? And the second question, which of the three vaccines, Pfizer, Moderna, or Johnson & Johnson, have the strongest efficacy against the Great Britain variant and the South African variant of COVID-19, and what is that percentage of efficacy? Thank you.
All right. I was listening so hard to the second question on those percentages and seeing if let me do the second part first. And that was sort of, how protective are they? They were tested in different populations in different locations. And I mentioned the Johnson & Johnson, but I think that we're saying that people are confident that all three are protective against severe illness and dying from coronavirus. Now, they're doing a lot of studies in the laboratory and looks at antibodies and how protective they are. There's more and more research coming out over time, but generally, which is why I said that if you're offered a vaccine, my advice is to take what you're offered and get your first and your second shot. Both of the Pfizer and the Moderna vaccine require 2 shots to be protected. The first one sort of primes your immune system and you get some level of antibodies, and the second one really gives you an antibody boost. And then the Johnson & Johnson is just the 1 shot. Now, the question is, can you get your vaccine, can you infect other people? There's some unknowns on that, which is another reason why people are saying, keep wearing your mask, practice the behaviors that the health department and the CDC is telling us. Wear your mask, avoid crowded, particularly indoor spaces, keep your physical distancing. It's likely, based on the science, that our transmission is reduced, but there's some gray area in there about 100%. So there's an element of caution there, which is why, as you see, CDC put out the recommendations, and our own health department have too, about once you're vaccinated, what should you do and what shouldn't you do? And you can be with other vaccinated people with no mask on. But people are saying there's a little bit of limitations. You could be with people who haven't been vaccinated, but if they're in a high-risk population, like they have a chronic condition, you need to be a little more careful about that. So we're sort of in the process of learning that, I guess, and sort of not having everything 100% determined. I guess I don't think people try not to be uncomfortable about that, because that's just the state of how fast we're learning. And the amount of scientific knowledge that's coming out every day and every week is amazing. So that will help us in the long term. There's a little bit of ambiguity in the short term. And my advice continues to be, our health department puts out great recommendations daily to weekly. CDC has guidelines for all these same things we're talking about, and check for the latest on those.
Great. Fred from Chester wants to know, what are the side effects from each of the 3 current vaccines and from the variant boosters, if when available?
Generally, the kinds of side effects people get, you might get a sore arm for a day or up to a week. With the booster shots, some people most commonly are sore arm, could have a low-grade fever, little muscle aches, sometimes headache. And it really depends on the individual. And those have been the most commonly reported. All the reported side effects that are being seen are again on the CDC website. But those are the kind of things. And that actually is a reflection that, yep, you've got your shot and your booster.
Good. Next, there's a question from Lee, who lives in Saxton's River. He wants to know, how long will the vaccination be good for? Will it be like getting the annual flu shot? For example, if I plan to travel a year from now, will I need to get vaccinated again before leaving?
You might need to check back with us in about 6 months for that one, because that's exactly one of the things that people are studying. And the current recommendations are, even if you've had and recovered from coronavirus, you still get a vaccine. Because one of the things that the scientists and public health researchers are looking at very carefully is, if you've been infected, how long does that immunity last? And likewise, if you get a vaccine, that's another thing that people are studying. So stay tuned for that. Both that question and the question about the variants, will we need to have a booster? This is not the flu. It's a different virus, a different category of virus. But I think that flu comparison is familiar to people, that it changes a little bit. So we need a different vaccine every year. We don't know that yet, but those are some of the things that are being discussed and people are asking and trying to answer.
It's going to take a while for the science to settle out, isn't it? It's hard to deal with uncertainty, but that's where
it is.
It really is. Yeah. We have a question from Margot, who lives in Putney.
Margot from Putney asks, I'm currently trying to conceive. I have no issues taking the vaccine pre-pregnancy, but I am not yet eligible. I'm very nervous about the vaccine while pregnant, especially during the first trimester. I'm 39 years old and I have a history of miscarriage. I want to protect myself and my future baby, but whether I choose to vaccine or delay, every choice seems risky. Beyond simply talking to my doctor, what do you suggest? Thanks.
I suggest you talk to your physician, or if you see a nurse practitioner, whoever's providing you care. And if that is someone you have a relationship with and trust, and that person will know your own medical history and have a conversation with you about the benefits and any potential risks, and the balance of the risks is to you and also the risks of getting disease. So I would suggest that question, you should have a conversation with whoever's providing your health care.
So the next question is from Mimi of Hyde Park. She says, my husband and I will have had our first vaccine 3 weeks ago. Can we eat dinner inside with a couple who's fully vaccinated? Is it safe to fly once fully vaccinated? And is it safe to visit our grandchildren unmasked inside once fully vaccinated?
Wow. All right. Well, get your second vaccine, and it's kind of like there's sort of a lot going on here. And so maybe look at the CDC guidelines and the guidelines on our health department, start there, and then say, can I wait another couple of weeks till I get my booster? And then I know I'm protected. 2 weeks after your second shot, you should be pretty good to go. Travel, CDC, even with the vaccine guidelines, I looked at that very carefully, and they hadn't yet changed their travel recommendations for travel generally. And so I'm watching that and saying, they haven't opened up everything and said do everything. They're saying sort of be cautious, and we're still not having contact with large groups of people and large crowds. I think all these things require some judgment. So I would check with that on the CDC website. I would suggest getting your booster and waiting a couple weeks, and then revisiting all those things that you just asked.
Good. All right. So next we have Barb from Cambridge has a question.
Barb from Cambridge asks, can a fully vaccinated Vermont household gather with another non-vaccinated household from out of state? A family too young to receive vaccinations at this point from New Jersey.
I don't know. I don't know the answer to that. And I think I would direct you for that one to the health department website to see their most current recommendations on that.
Natty from Panton asks, how long does immunity last after receiving the vaccine? And does that depend on its brand, i.e. Moderna, Pfizer, or Johnson & Johnson?
After you get either your one shot of your Johnson & Johnson or your booster shots of either the other two, those, and from the current recommendations, you're having sufficient protection for serious illness and hospitalization and bad outcomes from coronavirus. And as I mentioned before, nobody knows exactly how long that will last. So that's something that's going to come forward. And there'll be more testing. People have been vaccinated. They're looking at anyone over time, groups of people. They're doing a lot of laboratory testing to look at this in a more simulated way in the lab. But I don't know a precise answer to that. I mean, it's likely in my opinion, that it's months. Whether we need a booster, we don't quite know yet. And this is the same kind of discussion, conversation that happens around all vaccines when they come out, and it varies. So I think it's a little bit of a wait and see here.
We have another particular question about who's eligible, and this is from Laura in Springfield.
Laura from Springfield wants to know, how do BIPOC individuals with a qualifying household member sign up for the vaccination? And how do people 16 to 17 years of age sign up for the Pfizer vaccine? Laura's husband is a person of color and a school employee. She would like to have their 17-year-old son who has asthma vaccinated. Her husband has already received his vaccine. Thank you.
My understanding is the simplest way to do that is go to the Department of Health website. And as they have currently said, the over 16 with the high risk people with any chronic condition, and that would include what you just described. So I would start there. Sometimes you go directly to the Department of Health. Sometimes you're directed to the option for different pharmacies. And I can't answer specifically for your area, and I would check with the health department website.
Good. Next, we have a question from Linda in Burlington.
Linda from Burlington asks, I have a coworker who's obese and has asthma. She will not get the vaccine because she says she heard that it is dangerous for people who have asthma. I'm worried about her. What studies or information can I provide to her to dispel her fears?
There's lots of great sources of information. Some is on our health department website, CDC, our FDA has great information on the process these vaccines have gone through for the emergency use authorization to be determined to be safe and effective for our widespread vaccination of our population. And that's on a general level. I guess I would advise, and something that there's a great ongoing survey from the Kaiser Family Foundation, and that's available through their Kaiser Family Foundation website. And they've been doing vaccine studies on vaccine hesitancy. Who's concerned? But the flip side, they're also looking at where do people want to get a vaccine? And if they're just not sure, who do they trust? And pretty much across the board, more than 80% trust a healthcare professional. So my advice is to have your friend talk to their healthcare professional, someone that they trust who knows them and their health, to have that conversation. Because in terms of people making that decision, it's a really important decision to protect our individuals' health, the health of our families. But you have to have that conversation, if you're not sure, with someone that you trust and has your best interests at heart. So that's what I would suggest.
Thank you for that. We have a question now from Denise of South Burlington.
Hello, Denise from South Burlington wants to know, if you take shot number 1 here in Vermont, can you take the second shot in another state? Would that be organized through, say, a pharmacy link at Walgreens, for example, instead of the Vermont Health site? And would it be okay if the second shot turns out to be from a different vaccine manufacturer? Thank you.
I think I missed the part about the in-state or the out-of-state. Is this if you got one, can you get it someplace else? Was
Yes.
that the question?
Yes, if you take shot 1 here, can you take shot 2 in another state?
It might be hard. I mean, the simple answer to that, it'd be simplest to get it here, number 1. And sometimes they won't let you. It's been pretty much state residents. That might vary a little bit, but I would try to get the second shot here. And then the next part of the question was about, should you get the same vaccine for the booster? And the answer to that is yes.
If you didn't happen to get the same shot, would it lessen the efficacy of the vaccine?
I think that I don't think that is known, but I think that what we do know is these vaccines were authorized under trials of thousands of people with 2 doses of the same vaccine. So we know that if you get the 2 doses of the same vaccine, it's safe and effective and will protect you from serious illness and hospitalization.
And the last question has to do with FDA approval. This is from Randall in Rutland.
Hello, my name is Randall Stevens, calling from Rutland. More of a concern about when these vaccines will receive FDA approval. My understanding is that the approval process is still ongoing and that currently we are under what is known as an emergency use authorization, but not a full approval. And I was just wondering if the professor could speak to sort of the uncertainties of taking a vaccine that is only under emergency use authorization rather than full FDA approval, which I believe is not going to happen for another couple of years at least.
The process for emergency use authorization. So it goes through all the same steps for vaccine approval. It's gone through what's called phase 1, where you look at safety, any kinds of side effects, what dose you need to use. Then that's up to like 100 people. Then you might have 100 or more where you do more of the same and refine that, see what are the most common side effects. Then you move to thousands of people in efficacy studies where you compare the efficacy of the vaccine in people getting it and a control group getting placebo. And those were for the Pfizer vaccine were on the order of 40-some thousand people. And for the Moderna vaccine, 25,000 people who got, and 30,000, then about 25,000 who got both those vaccines. Those are large numbers of people in these trials. And then you get this emergency use authorization. So those are the phase 3. What's phase 4? Phase 4 means you don't stop after you do the authorization, and then it can be out for use, safe and effective. And I highly recommend that I have confidence that the approval has been rigorous, the testing has been extraordinary, and I'm happy to tell you how that could happen so fast. But I want to finish answering the question about, what's next. It's called a phase 4, where they keep looking at any long-term adverse effects. And so they continue to study people who've gotten the vaccine. And that's why it's very important to do that, to see if something that could be very rare comes up after a long period of time. But I guess my message is we don't need to wait for all that phase 4 data to be in what has gone through in that emergency use authorization. I have a high level of confidence in that and the steps that have been taken to get this out to everyone.
Oh, wonderful. Jan, is there anything else you'd like to say about where we are right now with the vaccine rollout and
If your opportunity to get a vaccine comes up, please say yes. Sign up. As I said, I was delighted. I recommend it. I have confidence both in the FDA, the CDC, and our health department's rollout of this. In the meantime, while we're getting more and more people vaccinated, please follow those common sense precautions that they've been telling us about mask wearing and physical distancing and being careful in those crowded spaces, particularly inside. And if we all do that, it's really, really hard. Everyone is pandemic fatigue and beyond, but we're going to get to the finish line. And I know we can make it.
Jan, well, thank you for that vote of confidence in Vermonters. And I want to thank you again for taking the time to be with us and to thank our sponsors, Garnet Health. Thank you, listeners and viewers, for being with us tonight.